Hello and welcome to the Skin Therapy Show, and I'm back here again with Domiana. Karibu Mama.
Asante, thank you. Yes, I'm good, been good.
Karibu. So Domiana today is going to be able to show us the procedure. Maybe you'll be able to explain to us the procedure she's getting, you know, what goes behind it, how long it takes, and if there are any effects to it.
So as we talked before, this is an acne treatment. So Lydia, she's just done a DMK chemical peel. So a DMK chemical peel, it treats acne, and it treats from the layers, deep layers of the skin. So this is now the procedure. We can see for the people who've never seen or known how chemical peel look like. This is how it looks like when you apply it. So she's trying to arrange it to dry it properly, so it can suck all the oils, excessive oils, and if there's any bacterial acne on the top of the skin, now it kills it and removes everything. So this one, we waited for a few minutes, like 10 to 15 minutes. Then after that, we remove it, clean it properly, and then we do another amazing mask also, which cleans up and treats acne as well. So basically, this is acne treatment. It's really
specific
good
for people with acne.
Yes, this is very specific with people with acne, and we are going to show pictures how she looked when we started with her, before and after. And we are still going on treating her. So we'll keep showing you on before and after pictures.
Okay, I can't wait to see that. And is it painful, the procedure?
The procedure sometimes is a bit tinkling, just tinkling, but we manage with a fan. We have the amazing fan that we keep applying it like that. So when you feel a bit of tinkling, it's quite normal. So we apply that fan for you not to feel excessive tinkling. But then after that, it's now good. You don't feel any pain or nothing.
Okay.
Yes.
Great. All right. Thank you so much, Domiana. I'm going to leave you to it. But for now, you've heard it from the professionals. If you have any skincare problems or if your breakouts keep coming regularly, make sure you seek professional advice, and they'll be able to recommend the best products for you. I've been your co-host, British Shigari, and we'll be right back. Don't go anywhere. Back to you, Joy.
Welcome back. This is the Skin Therapy Show. I hope you've got your Minute Maid with you. Remember, it's got something that everyone can enjoy. It's made with the freshest ingredients to make sure that you have the highest quality of juice. Minute Maid, filled with life. We've been talking about acne today with the lovely Domiana. We have had the conversation, and there's so much to talk about when it comes to this. We've seen a little bit about some of the, we saw a demonstration just now about different types of treatments that are involved here. Complications, people might be, afraid, especially your face. This is what you don't want to ruin. They're like, what if I treat it and it gets, worse?
Yeah, so most of the time, acne clients, they're too scared of how will turn out to be, because they normally come with so inflamed skin, with cystic acne. So they are thinking when you do this treatment, it's going to get their skin a bit more worse. So they are so scared as a point that we actually first do a counseling. We talk to them, we show them actually a before and after pictures. We keep showing them how we treated this client and how after 2 sessions it looked like, and what are possibilities of during the treatment, how they will feel immediately after the treatment, what they are going to see, how their skin will turn out to be. So we explain completely what is happening during the treatment, after the treatment, and we show pictures. Because of course already they are too scared of their skin. Yeah. So we need to affirm them on how the treatment will turn out to be and how they will look like. At some point we tell them as it is, when we first treat the treatment, the first session, the acne tends to be a bit more. So we also communicate that before treatment, because we treat acne from the layers of the skin, from the dermis, epidermis, and hypodermis. And the moment we touch the skin like this, probably they have not been cleaning their skin properly. The moment we clean and remove that, then whatever was clogged down the layers of the skin comes out the following week. So we prepare them. Their skin will turn out to be a bit more for some skins or for some type of skin. So we make them aware of what's going to happen, but then we show them it's going to shoot, but a little bit of some days, then it comes down, then goes to a plateau, then it can again go bad, then we treat again, then it goes improving. So we make it very clear on the outcome, but then the end results are amazing. Yeah.
It's quite the process.
Yeah, it's
and
a
it
process.
takes a lot of courage.
Yes, it takes, yes, and also it takes a lot of patience with our therapists. They are trained every 3 months. We have refreshed training on how to take our clients' journey, how to work with them. Because it's not just treatment. I come, take you to the bed, then go tell you bye. We have to keep contact. We have to keep calling the client, encouraging them, telling them, how are you using your products? Did you do this? Did you do this? So it's basically working with the client. It's a journey. So we keep retraining our therapists to do their best, because when our clients come, they're so heartbroken, their self-esteem is gone. So we uplift them by encouraging and talking to them every 2 days. And making sure they are following the procedure on how to use the products.
It's important to have someone like that in your corner when you're going through something like that, where it's bringing down your self-esteem. You need someone to kind of rally for you. We've talked a little bit about food and nutrition and what that has to do with the advent of acne. But just for someone who's thinking, okay, at which point do I come and see you?
At the point whereby the first time, like the way you said, I have some people like 1 or 2. If you have a skincare routine and you can manage that, you can manage. But when it becomes a bit more, when you look yourself at the mirror and you feel like this is not me, then rush to a therapist or aesthetic clinic, get help. Because when you treat it early, then you don't go a long way. It's actually cheaper than waiting when it's acne, it's at grade 4, then it takes like almost 6 months for treatment to do. So when you look at yourself at the mirror in the morning, you always see and say, wow, this is Domiana looking nice. So when you look and I notice 1 or 2 is happening, then go to a specialist, aesthetic clinic, get help, get diagnosed, and don't prescribe yourself, then go to chemist. Or sometimes we watch a lot of videos and bloggers,
YouTube,
and sometimes we get confused, or we get so much and we think now we know how to treat acne. I would say, again, no, go to a specialist, let them check your skin, because we are all having different conditions. You might be having acne and at the same time you're having eczema. And probably you watch a video, you watched a clip, and you're thinking this is the right route. But when you go to a specialist, they will tell you have now 2 conditions, that we need to treat this and do 1, 2, 3. You understand? So don't prescribe yourself, just go to a specialist to get a proper diagnosis.
The internet is not a doctor.
Yes, true.
Okay, can you give us some final comments, Doviana, about the topic we've been talking about today, which is acne? And also tell us, where people can come to see you, or if you're online.
So I would say, like I said it again, go to a specialist, get a solution, and don't prescribe yourself, or don't use someone's products, skincare they are using, and you think it will work for you. No, just go. Do your proper research on where to go. Nowadays, there are reviews you can check through online. You can go to the place to get a consultation just to know how good is these people are doing their work properly. And just go online. You get everything reviews. So just make sure you go to a proper esthetician to take care of your skin, or to a dermatologist. So most welcome to Skin Soul. We are at Westlands, Woodville Grove. We are at Brickcourt, our 2nd floor. Our number is 0743 364717. So most welcome to Skin Soul. On IG, we are called Skin Soul _aesthetic. Skin Soul _aesthetic. So come here, talk to us. We'll give you solutions that you're looking for. Thank you very much for having us.
Thank you, Doviana. Remember, there's no shame. It's
Yes.
a common, skin disorder, and it can be treated. So make sure that you're getting the help that you need. And I hope you've grabbed yourself some Minute Maid at a store near you. It's got something for everybody, a huge array, as you can see here, using only the freshest ingredients to make sure that you get the highest quality of juice. Minute Maid is full of life. And if you have any questions or comments about the show today, or just want to contact us to say hey, make sure you do that on social media. We are on Instagram, Facebook, and Twitter at The Skin Therapy Show. My personal handle is at Joey_Mutengi on Twitter and IG. Until next time, thank you so much for watching. Bye. Acne is one of the most common skin conditions, and while it is common, accurate information is often scarce, making it that much more difficult to get clear skin. Today on the show, our experts will help us understand acne and how to treat it. Thank you so much for joining us. This is a Skin Therapy Show. My name is Joey Mutengi. Let's get started. All right, let's get things started here on the Skin Therapy Show. As I mentioned, we're talking about acne today, and we're back at Skin Soul with the lovely Domiana Mwangangi. It's great to see you again. You're looking lovely.
Thank you.
Purple looks good on you.
Thank
Anything
you.
looks good on you.
Thank you. Thank you.
Thanks for having us. We've got our Minute Maid. You can feel free to have a refreshment as we go along.
Thank you.
So we're back to talk about acne, and I know that it's a wide, area of skin related issues. So maybe we can talk a little bit about areas that are more prone to acne, because we see people getting acne not just on the face, in areas of the body as well. But which are the areas that are most prone, would you say?
Okay. So my name again is Domiana Mwangangi, founder of Skin Soul Aesthetic, and I'm really happy to be back here again. So today we are talking about acne, which is very common condition that we treat. So I would start with explaining what is acne, because probably many people don't know about acne and what it is. So it is it's a skin condition which happens whereby the hair follicles on the skin, whereby there's infection or there's something happening which is not normal, then it gives the skin inflammation, then it gives pimples or bumps. Yeah, so that is when the acne happens. So when there are raised bumps on the skin and the follicle which is inflamed, then we call it acne. And then back to your question, you had asked which part of the body, or where the part of the body we have acne, where it's prone. Mostly it's on the face, around the chin area. Again, we are still getting so many people getting acne on the pubic area as well, because of the way they remove their hair. So we are getting so many people. Many people, they don't know it happens, but it happens around bikini area. So it also happens around the chest also. Chest area also happens. At the back also happens, and also at the butt. Yeah, we really get so many clients happening at the back. So if it happens at the back, it doesn't mean it's not acne. It's just normal acne. We just need to know how to treat it.
Oh, wow.
Yeah.
Okay, I did not know half of that information.
Yes.
So thanks for sharing. And those are all areas that you treat.
Yes.
So is there a difference between, okay, I have a pimple on my face right now, right here. Mm-hmm. If I have a pimple, is this acne or is it just a pimple? Like where is there a line between these are just pimples and then this is acne? Or is it all the same thing? Okay,
we would say there are grades of acne. The moment you get a raised bump on your skin and it's inflamed or it's red, then that gives it, we can call it acne, but now the grade, we would say it's very mild, or grade 1 of acne, where it just starts with the raise of the bumps. and inflammation, and sometimes it gets blackheads and whiteheads. So we would say that is just mild acne or grade 1 acne.
Right.
Yeah. So we would say that is acne. So we will need, when you tackle it very early stage, then we will tackle it like 1 or 2 sessions, or just using skincare products and gauze.
Yeah.
But then it gets worse as someone they don't know what they have, they don't take the proper precautions, they don't treat it properly, then it gets to grade 1, grade 2, and probably it gets to a different types also. There is bacterial acne, there's acne vulgaris, so it gets to different stages, and it takes different routes and gives a different name.
So there's different types of acne as well.
Yes.
And that's something you can diagnose?
Yes, this we diagnose. Like we have acne, cystic acne. So it's whereby you start with grade 1 with just blackheads and whiteheads, like the way you're saying you have a pimple. Then you don't really take care of it. You just probably ignore, or you assume it's going to go. Then probably you see it after 1 or 2 months, it keeps, because we get acne by excess sebum production from the skin. Okay. When we are excreting, when there's no proper route of the excretion to happen, then there's bacterial infection, then acne happens. So it can get worse if it is not cleaned well, it is not treated. So then when it gets worse, then it goes to acne, cystic acne, whereby we get pustules. Pustules, they are big bumps with us pus inside, and they're very painful. Sometimes they're itchy, and then also it affects the area around the raised bump.
Yeah.
And then they multiply. So you find that they're all over and they're big. Cystic means they're bigger than normal, just a normal pimple. Right. So we call it cystic acne.
Yeah. We've talked about different areas that are more prone to acne, and someone could be sitting at home thinking, okay, I have acne on my chest. What caused that? I know you've talked about the bikini line, and that's due to like hygiene in terms of how it is that you are maybe shaving or things like that. But in terms of just different areas, are there different reasons for different areas?
Yeah, there are different reasons for different areas. For example, I would say the chest. Probably if someone would sweat this dirt and they don't use proper shower gel or proper soaps to remove the dirt, and then there's excretion happening. When there's blockage of the oils coming out, then acne happens. So around the chest, it could be because someone has not been washing properly, or they are not using proper products if they have prone skin around their acne skin around their chest area, or oily skin around their chest area. So if you notice your skin is a bit oilier on your chest, depending on how you're getting pimples, blackheads, then you need to get proper shower gel or proper soaps that you're supposed to use so that it can take care of the oil sebum secretion. Yeah, that could be one.
What about the back?
And the back as well, similar, because we just need to be aware of what kind of a body we have or the type of skin we have. If you notice you have acne at the back, then you need to get proper exfoliation happening. If you can't, then go to a spa. They do exfoliation at the back of your body. They exfoliate and they clean it properly for you. And they do proper procedure which takes care of that, and then they will also advise you on which shower gel or which soaps to use so that you can take care of that.
A lot of people, having acne, especially as an adult, which is something I didn't know happened, but I have experienced adult acne, and I was freaking out. It was during COVID, and I was like, is this COVID on my face? Like, what's happening? But, adult acne, we think maybe we left acne in our teenage years. But the reasons that acne happen in our teenage years, are they the same reasons that it happens maybe for us as adults?
Probably we would say at puberty it happens because of hormonal changes, but when it comes to adults, there are factors that can trigger acne. One factors would be climate change, or use of products that probably they're not working properly with your skin. That one would cause. When we say change of climate, when you move from a very hot area to a very cold area, and then you come to your normal area of where you normally stay. That change of climate also would cause acne. And also stress. Stress also would trigger acne. So for adults, we would say stress levels, factors like weather, climate change. Yeah, those are the factors. And also diet. the kind of food we take in also will trigger acne. So those are the factors we would check in when you have acne.
Yeah.
Are you stressed? How is my diet? Is it properly? So when you go into more protein, then you will trigger acne.
Really?
Yes.
And
And again,
people tend to think, let me eat more protein and less carbs if I'm trying to, for weight loss and all those types of things. But if you do too much,
if you do too much of protein, then you will trigger your acne. Or if you have a acne prone or oily skin, then you're prone to get acne.
Yeah.
So then again, there's a balance of what you're taking in. So it just balance and just be aware of your type of skin.
Yeah.
Yeah.
People, acne is a shameful thing for a lot of people,
Yeah.
and some people maybe don't want to come to see you. They're feeling ashamed, especially if it's showing up in places other than the face, as you've mentioned. And with the face, a lot of people just want to cover it up with makeup.
Yeah.
And think, as long as I can't see it when I look in the mirror, it's not there.
Okay. Yeah.
What would you say to someone who's feeling that way?
So I would say makeup is no solution for acne. You will need to tackle it from inside and to the core problem, because when you cover it, you make it a bit more worse.
Yeah.
So just come out here now. Acne is just, we have aesthetic clinic around. You just need to go to a proper aesthetic clinic. You get diagnosed first. They know at what grade of your acne you are at, and then they guide you, because now this is a treatment. It's a step-by-step treatment.
Yeah.
Yes, but covering with makeup, it will make it a bit more worse.
Yeah, and I think it's so important for people to understand how common this actually is. As in, you're not the first person to get acne.
Yeah.
As they come into your clinic, and just understand that you are going to be understanding of them as well.
Yeah. So what we keep telling our clients, I mean, this is very common. Actually, it's the most treatment we do every single day.
Yeah.
We have clients calling every single day, from teenage to adult. Even we are getting clients who are getting menopausal acne as well. Someone they've never experienced acne, adult, puberty, but they're getting it at their 50s and 45. And it's actually really bad. For the clients that we treated, it comes out so bad, even worse than adult or puberty. So anyone can get acne, even men. We have so many men. We will show you some pictures. We've treated men who had severe cystic acne. So we would want to tell you, like, you're not the first one, or it's really common, and there's solution, and it is treatable. You just need to come out, and you just need to know where you're going and the right places to be treated.
Does genetics, or do genetics play a role in formation of acne?
Yeah, so previously I've done research, and I keep reading and going back to books to read more about this acne, because I mean at some point you get to know to the core problem and where it comes, because we have all these questions our clients keep asking. So I was reading, and a research has shown that if your parents had acne, 3/4 of their kids will have acne as well. So basically it's genetic. Yeah, it's genetic. Okay. So then we would need to know if your parents had acne, then you just need to be aware. Then mom struggled with acne, then me, I'm getting, so I really need to take care of this now before it gets worse. Yeah. So we just need to know the history of our parents, how their skin was, because it's genetic. There is no quick fix when it comes to skin treatments. That is what I will say. If you want
long-term effects, you gotta be patient.
Yes. Yeah.
We've got more with Domiana in a bit. Of course, we are going to see a demonstration of sorts. I never know what you're going to show us, but it's definitely going to be something new in terms of skincare here. We are at Skin Soul talking about acne, throughout all ages. So we've got more information coming up next. Stay with us. This is the Skin Therapy Show.